Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units to provide quality care, whilst saving money and resources. So in today's video, I want to talk about how can you as a family obtain funding for a service like intensive care at home, because we are getting this question from families all the time. Families mainly who have a loved one in intensive care, or families who have a loved one at home and have a loved one on life support, meaning ventilation, tracheostomy or bipap ventilation, or sometimes clients may not even be on a ventilator, but they may be having medical complexities such as complex seizure management. And especially with complex seizure management, patients might have an unstable airway, and an unstable airway needs the skills of an intensive care nurse. Hence, intensive care at home is the right service for that. So we're early 2020 now, and as of 2020, there are several ways of obtaining funding for intensive care at home, 24-hour nursing care with intensive care nurses or pediatric intensive care nurses. So as some of you may know, the NDIS, or the National Disability Insurance Scheme, has kicked in for a few years now in Australia. And the National Disability Insurance Scheme has started to fund nursing care, right? And with that, the NDIS is funding nursing care. You need to obtain medical and nursing evidence that your loved one qualifies for that. But I can assure you that if your loved one is on ventilation and tracheostomy, most likely they will qualify for 24-hour nursing care, as most of our clients have obtained that funding already. Now, this is often not an overnight sort of event, but we have advocated or helped advocate for so many clients now, and we've done a lot of legwork for our clients successfully. Otherwise, we wouldn't be in business, and we wouldn't be helping clients to stay at home instead of intensive care. So the NDIS is one funding avenue, but sometimes we get funding through public hospitals as well. And in other instances, we get funding through private health insurances. Or in some instances, we get funding through a hospital in the home model, or through a palliative care in the home model. So the bottom line is this, that whether you have a loved one in intensive care, or whether you have a loved one at home on a ventilator, but you don't have the support your loved one needs if they are on life support and ventilation, because ventilation and tracheostomy skills take years of training, specialized training in intensive care. So you can't just take lay people off the street and look after somebody on a ventilator with a tracheostomy. That's simply dangerous. You know, if your loved one goes back to intensive care, they wouldn't be having somebody off the street looking after your loved one. They would have a fully qualified intensive care nurse looking after your loved one. And we offer, at the end of the day, we're offering an intensive care substitution service that's highly valuable, because where would you rather be, at home or in intensive care? I think the answer is rather obvious, especially if you get the same care and treatment at home. The other issue when patients are either in intensive care long-term on a ventilator, having a tracheostomy, or even if they're only on non-invasive ventilation like BiPAP or CPAP, the cost is enormous. So the cost of an intensive care bed is around $5,000 to $6,000 per bed day. On top of that, ICU beds and pediatric ICU beds are in high demand. So that means if a long-term patient occupies an intensive care bed, they're bed blocking other patients that need an intensive care bed. And often surgery gets cancelled. ED gets bypassed the emergency department because there are no intensive care beds. So there's a much bigger picture at play here. Why our service is not only valuable for you as a family or for a client, but also for a hospital and for the health system in general. So with that cost, with that high cost of $5,000 to $6,000 per bed day in intensive care. That's why a HIF model or a hospital in the home model is so attractive, because under a hospital in the home model, we can cut the cost of an intensive care bed by about 50%, and we can free up the intensive care bed, and you as a family can be at home. So it's a win-win situation altogether. So it doesn't really matter where the funding is coming from, whether it's through a hospital in the home model, whether it's through the NDIS, whether it's through the Department of Health. I should have mentioned that earlier. We're also getting funding through the Department of Health, because again, we are providing a win-win situation, and the Department of Health, for example, would fund an intensive care bed that costs them $5,000 to $6,000 per bed day, and instead they're paying us about half of that cost, and they're saving half of the cost of an intensive care bed, and they have more resources available in intensive care. So again, what we are very experienced with is we have pretty much done a lot of the advocacy for all of our clients, successfully done the advocacy for all of our clients, because again, otherwise we wouldn't be in business. I started the service from scratch, and nobody was giving us money in the beginning. So we had to successfully advocate. We had no other choice. We had to make this work for our clients. Otherwise, again, we wouldn't be in business, and we wouldn't be successfully keeping intensive care patients at home with intensive care nurses 24 hours a day. And we can do the same for you, because we are so highly specialized. We understand intensive care inside out, and we also understand the home care sector of intensive care inside out. And we know how the two overlap. And we know how we can get you the funding that you will need to improve your and your loved one's quality of life. So really, it's a case of you contacting us, and we can help you to take the next steps to get your loved one out of intensive care. Or again, if you have your loved one at home already and they're going to ICU regularly, or you're struggling with support because you don't have intensive care nurses, please contact me, and I will take you through the next steps so that you can use intensive care at home as well. Thank you for watching this video. So if you want to again find out how we can help you, please contact us on one of the phone numbers on the top of the website, or send me an email to patrick@intensivecareathome.com. That's Patrick, Patrik, @intensivecareathome.com. Also, if you are an intensive care nurse or a pediatric intensive care nurse, please check out our career section. We have multiple vacancies for ICU and pediatric ICU nurses in the Melbourne metropolitan area, including the Warragul area, Sunbury, the Mornington Peninsula. So you're very welcome to contact us if you're an intensive care nurse. Please also check out our services section, where our services are broken down into segments when it comes to clients. Also, we have been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you so much for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll talk to you next week. Take care.